Now we go towards the discussion of the most important part or a problem or a hindrance which we all are facing today, like how to run an OPD and what precautions to take in the OPD and how to serve the society as well as to protect ourselves. એટલે આપણી સુરક્ષા બી જરૂરી છે. એટ ધ સેમ ટાઈમ આપણે સોસાયટીને એવું બી નહીં કહી શકતા કે ડોક્ટર્સ પ્રેક્ટિસ નથી કરી રહ્યા. To discuss about that topic and to give some points or hints about that thing, we have a very senior physician, Dr. Mukur Petrolwala. He is CEO of Tri-Star Hospital, and once again I would request Dr. Petrolwala. He is a past president APG, past president APS, past president SMCA, and a very good analyzer to talk with us about this topic. And thank you Tri-Star Hospital also for providing us this venue for doing webinar. So Dr. Petrolwala sir, please.
Hello, good morning. Sorry for the slight delay in starting of this program. When we were conceptualizing this program on a webinar on COVID-19, we were thinking, oh, isn't there an overdose of information? So friends, the idea of this webinar is to provide information related to our city and our state. All the associations of Surat, practically all medical associations are a part of the Corona Action Committee Task Force, and IIM has taken this lead to bring this seminar to you on behalf of all the associations. So for all doctors, what we try to bring to you today is OPD care in COVID time. That is a topic allotted to me, and when given this topic, the dilemma that most of us face is, should I run my OPD? Most of us would want to run the OPD, but we have some very legitimate concerns. And what are those concerns? First, our staff can't come or they won't come. They can't come because they don't have the curfew pass, or they won't come because either they are afraid or their families are afraid. Will we or our staff be harassed or persecuted? That is another concern. Thankfully for us friends in Surat, most of the police force are very sympathetic to doctors. Only thing that we have to take care of is that they are also working in this heat for many hours, and we don't have to sit on a high horse and try to expect everyone to be very polite to us. We also have to be equally polite to them and recognize that they are also facing danger in these difficult times. So persecution is another fear that some people have faced in their societies or residential areas. And again here, the administration has been very sympathetic to it, and all you have to do is to complain to any of the medical association office bearers, and that will be taken care of. The third concern that most of us have is, our place is very small. Won't the OPD infect us or other patients? Yes, that is a problem, and I'll be talking something about how we can or what we can do to reduce the chances of cross-infection. Can patients file a suit against the doctor if they catch an infection? Again, that I'll be talking about in the next slide. And what will happen to our family if we catch the infection and succumb? Dr. Chandra Jardosh has told about the ongoing efforts of the Indian Medical Association. In some states, the insurance cover that was extended to that was offered to the government employees has already been extended to the private sector, and I'm sure in due course of time that will be extended all over. There is another interesting part that I would like to remind you of, is the Epidemic Diseases Act has been put into force, and this has two clauses. One is a penalty. Any person disobeying any regulation or order made under this act shall be deemed to have committed an offense. At the present moment, the administration is not forcing us, but they have requested us, the SMC Deputy Health Commissioner or the Collector or all the our elected MLAs and MPs have requested us that doctors should continue their OPD. If by chance a scenario comes when all might be required absolutely mandatory, they can always invoke this particular act and force us to work. So that is one thing that we all have to keep in mind. And the second thing very important to us, to those of us who are worried about whether there will be any lawsuits that can be filed against us, there is a protection. Protections to persons acting under this act. No suit or other legal proceeding shall lie against any person for anything done in good or in good faith intended to be done under this particular act. So now, when we talk of OPD, let us just have a recap on the routes of transmission. We all know, friends, that it is a person-to-person transmission. Aerosolized droplets are the major cause of the spread of this disease, and therefore the social distancing of 1 meter that has been advocated all through. The second very important cause, which we'll all have to remember very religiously, especially in our OPD, is the spread through fomites. Surfaces, walls, files, case papers, reports, pens, stethoscopes, clothes. All these things are fomites which can have these organisms, and we'll have to take care of this particular scenario. The two other modes of transmission, airborne and fecal-oral, have been talked about a little, but right now we are not exactly sure about what is the relative importance of these modes, so we'll not bother about this. Hopefully it would not be that severe a way of route of transmission. Okay, so whenever we talk of OPDs, we'll have to talk of telephonic screening. It has been legalized. So now we are not worried that the telephonic screening might land us in a court of law again. Avoid walk-in patients. Please put up a board at your clinic which tells the patient to contact you on phone first before approaching the clinic, and limit your working hours. Limit your working hours to maybe once a day, to maybe a few hours, depending upon what you think is your workload. Try sorting out patients who don't need to see you by giving appropriate advice on phone, preferably after the video call. Fever, cough and dyspnea patients may be referred to cough OPDs. In Surat, we are lucky that 4 hospitals are running cough OPDs. Mission Hospital, Lokhat Hospital, Venus Hospital and Kiran Hospital. They are already running their cough OPDs. So patient with fever and cough, refer directly to these hospitals so that you do not expose yourself or your other patients in your outdoor. If you suspect that this patient might require hospitalization, at present there are again 3 hospitals which are authorized for that: Civil Hospital, Smimer Hospital and in private Mission Hospital. So if you see these type of patients, they have to be referred to these particular centers. So now what would be an ideal setup? Separate waiting areas and examination room for patients with fever and respiratory symptoms, if either you see them, if you choose to see them, or if they just land up as walk-in patients, and if you are not referred them elsewhere from the trial area, then you need separate waiting areas and examination room for these particular patients. Physical barriers, glass or plastic at the triage. Many of you might wonder what is triage. Even I knew this word some time back only. Triage is the area where the patient makes the first contact with the medical facility. Okay? So at the triage area, you introduce a glass or a plastic window like you have in theaters or you have in banks, and that would be an ideal way of dealing with this. If you cannot install it overnight, then at least increase the distance. From the reception table, just put one more chair additionally, and if the receptionist stands behind the chair of his or her own table, then you have at least made a distance of 3 feet. And that is what is required, a practical way of increasing the distance. Second, no crowding in the waiting room. No relative, or if a must, a single relative is allowed inside. patients should be sitting or standing apart or outside within the circles drawn. I saw it even at a Farsan house that they had put in circles, and they would tell you, okay, you can stand in this line. So people are getting used to it. There is no reason why they have to sit crowded together in your own consulting room. You have to tell them that these are the places only where you can sit or stand. All patients should be wearing a mask. So whenever a patient or the relative enters your clinic, at the gate, you might see whether that person is wearing a mask so that patient's droplet is not conveyed to other patients or to your own staff. And a minimum time should be spent in the chamber so that it's directly linked. About 15 minutes is considered a critical time which is required for the organisms to be passed to you when you are not doing any aerosol generating procedure. So avoid it, keep it to the minimum, 2 to 3 minutes, 1 minute if not required more. That should be the way you treat your patients in the outdoor. Personal equipment. Before we go to PPE, I am going to talk of PE. Personal equipment, phones. All of us carry phones all the time, and most of the times we have a habit of putting it on any surface. And then, or either when we are examining the patient or touching everything else, we would pick up the phone and start walking on it. So remember, phones are responsible for a very important way of spread. So do keep in mind this particular aspect, that the phones would require sanitizing every few hours or minutes depending upon how you are using that particular aspect. Keys and wallets. Keep the minimum thing in your own just carry a purse which has some amount of money, a plastic bag. Don't carry your purse. Keep a card which has your identity card or something like wallet which can be easily cleaned. Avoid leather purses which require more difficult sterilization procedures. Pens. Don't carry your pen from your dispensary or your OPD anywhere else. I have stopped carrying a pen in my pocket now. My pen is always in my chamber, and if I go to a hospital, I use the hospital pen and then immediately wash my hands. That is how it has to be followed by everyone present. Jewelry. I had to tell many of my female residents or staff members to keep their jewelry at home. It is not simply not allowed at the present moment. When you are examining the patients, the president is smiling at me at the present moment, but please avoid your jewelry at the present moment. Desk and computers. If you are working on this frequently when you are examining the patient, you will have to remember that these are other fomites. Foot covers. Many of us are involved in the latest fashion of wearing small socks or anklets as they are called. This is not the time to wear anklets. Go back to your old socks. We have gone back to many of our old traditions that we were doing, like getting back to Namaste from Shake Hand, and that is another thing that you have to go back to. Go back to your long socks and have good foot covers. Hair should be tied if long, and if they are long, then you should also wear a cap. Social distancing, I must say, is very poorly practiced in the hospitals. Yesterday only one of my colleagues phoned and told me that we are still not following it amongst our staff as well as we should. And we have to keep on doing this repeated retraining programs that limit the staff congregation to the minimum. Now, personal protective equipment. There is going to be another lecture on PPE. I am not going to give a big lecture on that, but doctor and the trial staff should have PPE, a mask, preferably a surgical mask, a respirator if you can get your hands on one when you are examining the patient, eye protection and gloves. These are ideal. If these ideal scenarios are not available to you, then you can do various jugaad. Like we all must have seen a photo on a WhatsApp where a doctor is examining a patient through the plastic curtain. Remember that the doctor is standing on one side, but if you do not clean the plastic curtain from the other side before the next patient walks in, then there is a patient-to-patient contamination chance. So if you are using these jugaads like plastic curtains, you will have to remember that you will have to disinfect that curtain as well. Helmet with a full visor can be another protective gear for the doctor and the trial staff in times of crisis. All of us, 25,000 PPE masks, our president of the Gujarat state branch just talked about, would be just one per day maximum, one per head maximum, and that is not going to last you. So you will have to design your own personal protective equipment in whatever best manner that you can. If we can get hold of the ideal equipment, that's fine. But otherwise, such jugaad items like helmet with a visor can serve the purpose. We used to joke about this when there was medical violence against doctors, that we should be wearing helmets. Probably we should be doing it right now much more effective. Gowns and scrub suits are preferred. If not, clothes on going home should be dealt with properly. In hospital, we have started using scrub suits. As a physician, I hardly had the chance to use a scrub suit, but nowadays I use it in my OPD as well. So, but if you are in your dispensary or in your consulting room where you don't have these facilities, remember that you'll have to discard the clothes that you wore in this particular OPD immediately after going home. And then there is a reuse. Whether it can be reused, most of the times no. You would have all heard that PPE should not be reused. And but then let me show you a video. Even foreigners elsewhere can do this jugaad. See this. Normally this mask should not be reused, but look at the way she is doing this. She wants to eat. She wants a cup of tea in between the 6-hour duty, and she has put it like this, and the box has her name on it, and see how she reuses it again once she has had a cup of coffee or tea. So these sort of innovations we'll all have to think of, keeping the basics in mind. And what are those basics? So is the basic mask etiquette. How to cover the mask properly. While in use, avoid touching the mask. Most of the times, what have we seen repeatedly, whether they are laymen or healthcare personnel, the person wearing the mask will just simply pull it off like this. You are not supposed to touch the front of the mask at any time. So that is what you'll have to remember. Remove the mask by using appropriate technique. You'll have to replace the mask if they become damp or humid. I'm sure there's going to be a lecture on PP, so I'll not go into great details on this particular aspect. Clinic management. New prescription paper should be used every time. Avoid going to the patient's file and writing on the old case paper. Just keep the patient's old file at a distance. Ask him to show whatever you want to see. Tell the patient or the relative to only keep the file in their own hand. And then write the prescription on a new case paper. Preferably, if you are when you are wearing gloves and you don't want to write, you don't want to touch everything simultaneously. If you have an assistant, that is the best course scenario, where you tell the assistant to write whatever prescription is required to be written. The next thing is stethoscopes, if it can be avoided, should not be used. If you cannot avoid stethoscope, my cardiologist friends and intensivist friends tell me that they almost stopped using the stethoscope. Some of us do still use, but when we have to use, remember to sanitize after each use. Long tubing jugaads we have all seen, but most important, again, do not take your stethoscope home. Keep it in your office or in your car. Keep enough posters on hand washing, how and why, on social distancing, cough etiquettes and elevators. All these things should be kept in your clinic. Doors and windows should be kept open to allow free circulation of air. So that is a very, very important scenario. Disinfection should be remembered. Floors, surfaces, doors and door handles and knobs. So floors can be cleaned with the bleaching powder solution of 0.5 to 1%, and surfaces should be regularly cleaned and sanitized depending upon how frequently they are used. Doors and door handles or knobs should be always kept in mind. That's why doors should be kept open only, so that people don't have to touch those things. Hence, so जब भी कोई दर्दी देखूं मेरा दिल दीवाना बोले धोले धोले, that should be the criteria. that we have to remember. Very frequent hand washing is the most important thing. Clothes I already talked about, that you do wear long sleeves preferably, and change if possible. If not, on going home, change immediately. Do not open the door with your key as I would normally do. I ask my wife to open the door, simply go inside and change. That's the way to do it. PP, someone else will be talking about later. Dr. Anil, I think you are going to talk about? Okay. Drug prophylaxis. Finally, the thing that worries most of us, whether we should be taking drug prophylaxis. Right now, chloroquine and hydroxychloroquine have been recommended. Because we trust more data coming from the US, they have more experience with hydroxychloroquine and therefore more suggestions are from them. Even ICMR has recommended hydroxychloroquine, and the ICMR recommendation is hydroxychloroquine 400 milligram twice a day on day 1, followed by 400 milligram once a week for 7 weeks for healthcare workers. All those people who are involved in treating, only these people need to take hydroxychloroquine, not everybody in the general population. The second the second group of people who require HCQS prophylaxis is those people who are taking care of proved corona cases. Then these people should take it in 400 milligram on day 1, followed by 400 milligram weekly for 3 weeks. Azithromycin is another drug which sometimes is taken off, is talked of as prophylactic. It is not recommended. Remember, there is a small problem of QT prolongation. QT prolongation, if you are slightly old, if you have some comorbidities, and it's better to take an ECG first and see if there is a QT prolongation, then avoid hydroxychloroquine. All of us of our generation have taken enough chloroquine in the past and have been used to it. So chloroquine is a good substitute. You can always take 500 milligram of chloroquine weekly, and that should work as a chemoprophylactic drug. There is some talk about BCG boosters and all that, but right now we don't know what is the actual scenario for these particular things. I guess, friends, that's what I wanted to talk about as far as the OPD practice is concerned, what we can do and what we should do in this particular scenario. Thank you.